So there are few competencies that I feel that is going to be so needed within the healthcare sector as we adopt and integrate technology, that I really want nurses to begin to think about it. So number one is UI UX. As someone who is currently building a product herself, there is an intersect that must happen between a product that wants to go live or a product that wants to solve a healthcare issue. It is very important that people build with the concept or with the mindset that it must be usable based on what we've seen as a healthcare problem, based on the solution we want to provide. Let's bring these AI tools and let's put one or two together that it can provide this particular solution for us in this particular way, and we want the result to come out this way. That is the game changer. Being able to build AI tools for healthcare professionals, for healthcare solutions, it is a game changer. Hi, welcome once again to Nurse Elevate, where I share insights, especially for nurses within the UK where I reside, on how they can elevate and sometimes cross across globally to all nurses within the globe. And today I just want to kind of share a bit of insight on some of the things I see as the greatest opportunities that would be coming to us nurses, especially in the AI age or in the technology age that we have currently. And this is in terms of skills that you should focus on. So there are few competencies that I feel that is going to be so needed within the healthcare sector as we adopt and integrate technology, that I really want nurses to begin to think about, to begin to focus on as well, to begin to find a way on how they can gain those competencies. So number one is UI UX. I haven't gone through the master's program in digital health. I realize, and as someone who is currently building a product herself, some of the things I've come to realize from the place of reflection based on what I'm building, based on what I've read or I've been exposed to in learning during my master's program in digital health, is that there is an intersect that must happen between a product that wants to go live or a product that wants to solve a healthcare issue from the place of the concept or the insight of a healthcare professional. As a healthcare professional, you want to gain certification or competencies in UI UX. Why? Because it is very important that people build with the concept or with the mindset that it must be usable for the patients. Now, most of the time, products that we use within the healthcare sector would always differ in terms of how it's been, built. If we want to compare it with banking, insurance, marketing space, right? And that is why the intellect or the perception of a healthcare personnel is very important when you're designing the UI UX of the products, right? For those that don't know what UI UX is, it's basically the user interface and user experience, meaning like when you have an app, the experience you want your user to have when they're engaging with the app is literally determined by how the app is designed. And if you don't allow, or if you don't use the healthcare knowledge to build a healthcare app, you most likely will build it in such a way that it becomes difficult for the user to use, right, or to navigate. So as a nurse, what skills I really want you to start thinking of is how to gain certification or knowledge or skills around UI UX. Example, a product manager, those are the ones that are literally within that space, kind of like, have knowledge around that, right? The second one I've seen that is going to be very solid as well is data science. I realized that this sole AI that everyone is talking about is really built behind data. So, as a healthcare professional, what you would be able to bring to the table with having an additional data science knowledge is that you can source a data that would give the desired end of what the AI product will bring to the healthcare sector. Because not all data are used correctly, and not all data are fit for the purpose of why they have been built with AI behind them, right? So as a healthcare professional, having a good understanding of data science, you can help to, create great data that is solid enough to give the replication of what we desire that either the machine learning, the deep learning, or the AI itself should do. Because you're pulling the data from the insights of a healthcare professional who knows the heart of what this patient wants. So data science is a big deal. And you know that AI is as sophisticated as the data that backs it up. So having to bring an ordinary data science into the game of what a healthcare product wants to do from an AI point of view is not enough until you intersect with a healthcare knowledge. Do you see? An healthcare point of view. So as a nurse, please look for, if you're very good with programming, you love Python, because when I did AI in healthcare, my dear, Python is not for the weak. Even though I tried to understand it a little bit, it was still confusing because I was like, okay, what is going on here? But if you love things like that, if you love maths, I think there's a bit of mathematics behind it as well. Well, it's just programming, putting things together, and then it forms something else on the other hand. I'm like, oh, see the magic? If you love that, please get involved. Very well, get involved. Another space I would also be thinking is if you love coding. So there's what we call clinical coding, right? Coding in such a way that you code, data, you code all of those things that, all of those insights, all of those resources that we put together to create a clinical point of solution from the coding point of view, within the computer or technology space. So if you love that as well, that's another area you could add on to your data science. Another area that I think is going to be another beautiful game changer is in the place of project management. Being a project manager or a product manager is another powerful space that I can see really growing and it's going to be so big. Why? Because what we see happening now is that every single tech companies are wanting to build health tech projects, right? For either the government hospitals, public hospitals, or private practices, right? And what they would need, obviously, is a project personnel that can carry the project from the ideation to the reality and the manifestation of that project. So being a healthcare professional, you having that additional project management certification gives you a chance of being able to provide a template or a blueprint that is health inclined and technology is backed to provide solid solution from start to finish. Yeah. Another one that would also really be so good to have is the knowledge around AI. And when I mean knowledge around AI, I'm not saying AI prompting, engineering, all those things that will get how to prompt so solidly. I mean, it's still something we could obviously obtain. Prompting is really powerful because the more you're able to prompt, the more you're able to get a better result out of that, AI app or products. However, I think the most powerful ones would be those ones that can actually say, okay, based on what we've seen as a healthcare problem, based on the solution we want to provide, let's bring these AI tools and let's put one or two together that it can provide this particular solution for us in this particular way, and we want the result to come out this way. That is the game changer. Being able to use AI yourself, being able to build AI tools for healthcare professionals, for healthcare solutions, it is game changer. This is something I've been learning, and I know a bit of foundation about how machine learning works, supervised and unsupervised, how you put so much image on it, and that's where that data is coming. How you put so much image, so much data into it, feed it with so many things, recognizes it, and it creates different generated patterns of it, right? But beyond that, what else made it so solid? What made cloud, is it cloud or cloud? And these very common AI platforms that's overthrown ChatGPT. Is it Claude? Yeah, Claude. Claude. Tell me, how do you pronounce it? I don't know, but you know what I meant. Yeah. So how it became so much more stronger as compared to ChatGPT. Our co-pilot as well is taking over. Our Gemini. You see, how then do we, as healthcare professionals, use AI tools to bring solidified solutions? That is why you must learn AI itself. You must know how to build it and not just how to use it, because I think those are the game changers. And I think these are the few things that I personally have observed as powerful opportunities that if nurses can keep their eyes on it and become a expert subject matter, SME, subject matter expert. I don't know, subject expert matter, expert subject. You know what I meant? I don't understand. But yeah, you know what I meant. Yeah, if they can just be a subject matter experts, yeah, in that particular field, oh God, you will be so highly demanded, you'll be paid so well, and most of them show you are really remote jobs, because all you have to do is to provide a solution, and once you get it sent across to the stakeholders, the team, they can work on it. You literally are not really focusing on coming to the hospital, having a physical engagement with the patient. But these are opportunities that would help you with work-life harmony that we've been craving for, because surely a lot of nurses are underpaid, they are experiencing burnt out, they're having to work extra shift before they can survive. But having the skills would really change the game for you. Now, so tell me, which of these areas are you keeping your eyes on, and you're beginning to make research on how you can gain competencies and skills in it? And I will see you again soon. In the meantime, enjoy the rest of your day. Make sure you subscribe and share. And please tell me ways I could, improve. What else would you like me to share? Put it in the comment section, and I'll be more than happy to research on, share more light on it. In the meantime, keep elevating.